Hello everyone. Now I'll be discussing question of cardiology. The first line treatment of any case of severe hyperkalemia is injection calcium gluconate, and that we give by intravenous infusion. But this is absolutely contraindicated in hyperkalemia due to which of the following conditions? Well, out of the 5 options, it is absolutely contraindicated in hyperkalemia due to digoxin toxicity. We don't give. But why is it so? And that we will never understand unless you know the basic concept about what the mechanism of action of digoxin. Well, we are well aware that this increases the force of cardiac muscle contraction. That is so-called positive ionotropy, and that's why this drug is used in some cases of congestive heart failure. Now, it inhibits the enzyme sodium potassium ATPase, and this lead to increase in the intracellular sodium and extracellular potassium because this enzyme is not working. And now this sodium is exchanged with calcium. Sodium goes out and calcium comes in. And this increases intracellular calcium. And this increase in calcium increases cardiac contractility. Let me explain to you by this beautiful picture in front of you. So we have this sodium potassium ATPase, and normally this sodium goes out and potassium comes in. Okay. This is normal, what will happen in their normal cardiac tissue. Now, when we give digoxin or digitalis, this inhibits enzyme sodium potassium ATPase. Now, sodium will remain in the cell because it's not going out. So now, this sodium will go out and this calcium will come in. It means, if I have to tell you, simplify the subject, initially sodium was dating with potassium. Now sodium is dating with calcium. When the calcium comes in, and dating was done by sodium calcium exchanger. I think day-to-day example you will understand better. Now calcium has come in and it bounds to contractile protein, and that lead to positive ionotropy. Point to be noted that when we are giving digoxin, potassium is staying outside and that induces hyperkalemia. This is the basic mechanism. Well, now the things are very clear, the cards are open. So as I told you, for any case of increased potassium in the body, hyperkalemia, we give intravenous calcium because it stabilizes cardiac membrane and it prevents arrhythmias. This is for any case of hyperkalemia. But in digoxin toxicity, if you give calcium, more and more calcium will come in and that will increase toxicity. That's why we never give intravenous calcium in hyperkalemia due to digoxin toxicity. So now there are 2 important points. Effect of digoxin on potassium and effect of potassium on digoxin. Both have effect, right? So let's learn both of them. So digoxin toxicity and potassium level, as I told you, that it is going to block the sodium potassium ATPase, and with the result, normally as I told you, sodium leaves cell and potassium enters, but blocking this mechanism, serum potassium will increase and that lead to hyperkalemia. So more and more calcium comes in, sodium goes out via sodium calcium exchanger. So intracellular calcium within the cardiac myocyte is increased by digoxin, resulting in increased cardiac contractility. Okay. Well, so we learned the basic mechanism why digoxin causes hyperkalemia. Now, as I told you, treatment of any case of hyperkalemia is by giving intravenous calcium. But in this condition, if you give it will go massive influx of calcium will happen. The point I told you in the previous slide also. But it will induce irreversible contractile state due to impaired diastolic relaxation from calcium troponin C binding. This is a binding protein, it's a contractile protein. It will keep on always contracting, so it will not relax, and this is known as stone heart. So stone heart is the heart, just like stone, the cardiac tissue is always contracting, no relaxation, so that can induce the state of stone heart. Now, I told you in the very beginning, what is the effect of hypokalemia on digoxin? Digoxin lead to hyperkalemia. Well, I have a question. Now, this is a question for you. Stop the video, write down the answer. What is the effect of hypokalemia on digoxin? Digoxin toxicity actually get worsened with hypokalemia. Why? But digoxin normally bind to ATPase pump on the same side as potassium, as I told you. It's a sodium, potassium, ATPase, same side binding is there. So when the potassium level are low, then there is more and more place for digoxin to bind. So this how more digoxin binding will induce toxicity by hypokalemia. So end point of digoxin effect on to open membrane for calcium channel, and this results in increased calcium influx into cell, and this enhances digoxin toxicity. Now, one more question for you. Stop the video, write down the answer. What is the treatment of digoxin toxicity? Of course, no need to say that we have to withhold the drug, digoxin, but what is the otherwise acute toxicity is there, how you are going to treat. Write down the answer in your copy. Well, treatment of digoxin toxicity, intravenous fluid are given for hypotension. Monitor potassium level is very, very important. Hypo and hyperkalemia both can create problem. Correct arrhythmias, and if hemodynamically compromised or serious arrhythmias are there, then you can go for digoxin specific antibody, so-called FAB, can be given. Now again, question for you, one more question. Stop the video, write down the answer. What is the indication of giving digoxin specific antibody, that is FAB? What is the indication of giving? Stop the video, write down the answer in your copy. Well, we gave that FAB, Digiband. Administration include life-threatening arrhythmias, that may include ventricular arrhythmias, ventricular fibrillation, tachycardia, asystole, complete or high-grade AV block, and symptomatic bradycardia. By and large, any dangerous type of arrhythmias, we have to give FAB, and or evidence of end organ dysfunction, renal failure, septic shock, liver failure, or altered mental status. In all these status, again, we give digoxin toxicity. Finally, if the potassium level is more than 5.5, then again we can give this Digiband. Now, if you look into other option, A and C are incorrect, acute renal failure and renal tubular acidosis. In this, we can give injection calcium gluconate, there is no problem. And B and D, amiloride and spironolactone, we know that they are all potassium sparing diuretic. They can cause hyperkalemia. So in this case, stop the drug is the best place. That will automatically potassium level come down. But still the potassium level is very high. You can very well give injection calcium gluconate. There is no harm. There is no contraindication. Okay. So golden line to remember, digoxin toxicity can cause hyperkalemia. Intravenous calcium is absolutely contraindicated in hyperkalemia due to digoxin. Digoxin toxicity is worsened by hypokalemia. Thank you very much.